Hello, my name is Gabriel again, and this is my capstone project for music therapy for mechanical ventilated patient. Problem is in the critical care setting, patients are having such high levels of anxiety and stress whenever they're under mechanical ventilation due to the fact of having an endotracheal tube down in their throat, limited movement for being restrained, and basically difficulty expressing themselves. Purpose of this paper is to review the studies that shows the outcome of non-pharmacologic um, interventions, mainly music interventions, to for mechanically ventilated patients. The study was chosen to determine the benefits of reducing the levels of anxiety and stress, the reduce of the usual pharmacological measures, which is more sedation and more analgesia. The side effects is high in order whenever you use more of those medications, and of course the cost effectiveness of it. PCA is in patients that require mechanical ventilation. How effective is musical therapy? Compared to the other non-pharmacological interventions such as repositioning, hygiene care, in order to reduce anxiety, stress levels within a 12-hour shift or the duration of the patient's admission while being mechanically ventilated. A teaching plan is to educate nurses how to implement alternate and other non-pharmacological interventions, mainly music interventions. The target audience for this practice or this project is nursing students and new nurses with less than 4 years of experience. The class setting is for online video PowerPoint presentation within a part of their annual mandatory education. The evaluation for the effectiveness for this study is through a sample survey and questions, which is what are the goals of the intervention, which is the music therapy, required information that needs to be obtained for the intervention, and the questions, comments, and feedbacks. The presentation evaluation is basically, it was presented to 4 new graduate nurses. The PowerPoint presentation was sent via work email along with the sample survey and questions. They have few suggestions and few feedbacks. All the participants answered the questions correctly, but through the evaluation is ideally for more participants, a more classes should be offered and for different schedules, especially for the night shift nurses, and having the ideal situation would be a class setting with a face-to-face discussion. The teaching plan objectives was all met despite the presentation of the educational materials, which is the PowerPoint presentation, wasn't really the ideal way, which is in a classroom setting face to face, but still had a positive outcome. These are the appendices. This is the teaching plan table, which for the learning objectives for this one is for the nurses to identify the goals of intervention, which is the promoting intervention to impact or to lessen their hospital stay, lessen additional sedation, and the cost reduction. The time for that was for 10 minutes. Teaching strategies was the PowerPoint presentation. And the feedback and sample quiz survey, which is the evaluation methods. And the next learning objectives was for the nurses to be able to understand the important information, especially what to gather for the initial assessment. It was the outline is for them to figure out or to gather information about patients' music preference or genres. It was the strategies for that to teach him was still part of the PowerPoint presentation, and evaluation is through the sample quiz survey and the discussion. And last learning objective was to the nurses to understand and describe the importance of the interventions, especially in the critical setting. The outline was to ensure the appropriate way and implementation and for additional feedback. The time that is spent for 10 minutes, it's part of the PowerPoint presentation. And the evaluation methods is still through the discussion, feedback, sample, quiz, and survey. The educational materials was this music therapy intervention PowerPoint video that was used to educate the 4 participants. Hello, my name is Gabriel Gan. These are the sample quiz and survey, the appendix C, which is the evaluation method. The sample quiz and survey was the questions were: what are the goals for the music interventions for mechanically ventilated patients? Selected all apply. It goes through a shorter length of stay, reduction of side effects with the use of additional dose of sedation and analgesic, to provide music for patient during their stay, shorter time under mechanical ventilation, and all of the above. Number 2 is the patient's preference in music should be obtained initial admission during hospital stay. Is a true or false questions. Along with question number 3, are the patient's family allowed to bring personal audio materials for the staff to use? As well as true or false. A fourth one was in terms of evaluation for the presenter. Was the presenter or did the presenter explain and present the materials clearly and easily to understand? It's a Likert scale, which is strongly agree, neutral, disagree, and strongly agree. And number 5 question was more like a feedback about the presentation itself. The next graph was the music therapy goals, which is the question number 1 from the sample survey, and all of them answered it's all of the above, and they got it all correctly. And this is like another PowerPoint quiz in terms of how the best way to incorporate the intervention along with the routine care. It's a true or false. Everybody says true. For the second one, family being allowed to bring personal audio for patient use. All 4 participants answered true, and obtaining a patient's preference at initial admission, which is true, and everybody was correct. This is the Likert survey through a chart, which is they all answer strongly agree for the 3 questions of will the patient benefit with musical intervention? Will the patient benefit? Do you agree with the goals and outcomes of the interventions? And these are all my references. Thank you.